Okay, so again, let's start again. Sleep disorders. Sleep disorders are very common. It is very common in different communities and often go unrecognized. And we know that if we treat sleep disorders, there's a very good chance that we can treat it, and then it can also have a positive effect on your general health, but not just general health, but physical, mental, and emotional well-being as well. So that's the reason. I mean, we take sleep very seriously, but there are a lot of misconceptions about sleep. So I'm going to wait for Dr. Najeeb to put on the slides, because some of them, there are some diagrams which I need to show and some different stages of sleep. But I want to start with throwing out some misconceptions about sleep, common questions people ask about sleep. First of the question, one of the question is that how many hours of sleep do we need? And that's a very common question. So I want to just open it to the floor and see if people have thoughts about it. So what do you guys have, or any misconceptions or thoughts about how many hours of sleep do we need?
7 to 8 hours is the recommended.
And that's true. I mean, in adults, the National Sleep Foundation did a big research study looking at all the studies and putting it together. So the recommendation is about 7 to 8 hours of sleep. But obviously, it depends on a person's age as well, because, for example, young adults or teenagers need a bit more sleep. Kids obviously need a lot more sleep, but this is a range. It doesn't mean that this is like a norm. If you look at the curve, it is within that curve. Most people sleep 7 to 8 hours. So the key question is, if you ask a question, okay, how many hours of sleep do I need? The answer to that question is going to be, let's talk about how many hours of sleep did you need when you were in your late teens and you were on a summer vacation, and you didn't have to do anything about getting up in the morning or going to work or going to school. And if the answer to that question is about 8 hours, then that's the amount of sleep your brain needs. So it means that if you're getting 6, it means you're shortchanging yourself. You're not getting enough sleep, which your brain needs. So that's one of the misconceptions. People say, okay, I don't need much of sleep anymore. I can be without it. And there's a concept of what we call as sleep debt, which we'll see some slides on when we are able to see those slides, but we can talk about that in a few minutes. So let's talk about any other misconceptions, any questions you have. The participants, I mean, if there's any misconceptions about sleep disorders, or common questions you have, we can put it on there in my, I'm writing it down so we can review those.
One of the things I like also discuss is there are treatment of sleep disorder without medication, CBTI, if you can also talk.
Sure, we can certainly talk about that, yes. Anything else?
If you can talk to us about the emotional state and need for sleep or less sleep, and how
okay. So how does the emotional state affect? Okay, sure. Okay.
And what happens when we don't have enough sleep? What does it do to our daily life?
Okay.
You know,
sure. If you don't have enough
we behave,
sleep,
or how we react.
Okay. So what happens if you don't get enough or proper sleep? Okay. What else?
I guess I'd like to also learn something about a kind of behavioral changes that encourage better sleep. I mean, a lot of people are hooked to their devices until late at night. They're looking at screens and stuff like that. I mean, are there certain patterns of lifestyle change that encourage healthier sleep?
Absolutely. So that ties into CBTI, cognitive behavioral therapy for insomnia. So we can certainly cover that. Okay. Brother Najeeb, you are able to get the slides on?
Yeah, but I'm not able to transfer it to the presenter right now.
That's okay. We don't need the slides, and we can just go over.
Brother Najeeb, you can share your screen, and then he will see it. And once he wants you to change things, he will show you next slide or something.
But again, I can do it without it, but it's for the audience. I think it may be better.
Yeah, just attempt to share your screen, Najeeb.
Let's see if we can see your screen.
Let me work on that. You can go ahead and present. I will start working on it.
Okay, so now when we talk about sleep, there are certain misconceptions about stages of sleep, whether we are getting deep sleep, whether we are not getting deep sleep, what's the light sleep. So let's clarify that, because we obviously some of the physicians in the group know about it, but in general we can divide sleep into two different categories. One of them is called non-REM sleep, and the other one is called REM sleep. Now, most of us are familiar with the idea of REM sleep as the sleep which is considered as something where we dream. So REM stands for rapid eye movement sleep, and all of we know that we dream in that sleep. One of the misconceptions which I get it from a lot of our patients is they think that REM is the deep sleep, which is absolutely wrong, because REM is not a deep sleep. Deep sleep is what we call as N3 sleep or delta sleep. That is considered as more restorative sleep rather than the REM sleep. Now, REM may have some other functions, because the slides which if you are going to be able to see it, you'll see that we'll discuss some functions of sleep. What are the functions of sleep? And there are different theories about it. And we've learned a lot about what are the functions of sleep in the last 50 years, just like we've learned a lot about different organ systems and different functions of the body in the last 50 years as compared to the last 1,000 years. Now, one of the functions, and we'll talk about the functions of REM versus non-REM, but the major misconception is that we think that REM is deep sleep. REM is not deep sleep. Actually, it is rapid eye movement sleep, in which people dream. However, when we are dreaming, we are actually in a very light sleep, meaning that if somebody touches you or somebody calls your name, or you can wake up very quickly and your mind is going to be very refreshed. It's not going to be that you will be coming out of deep sleep and you don't know what's going around you. So REM is, because the REM state is a very highly active metabolic state in the brain. It is not a relaxed state. So one of the misconceptions about sleep is, well, when we're sleeping, our bodies are relaxing and our minds are relaxed. That's not accurate, because REM is highly active metabolic state in the brain. Even though when we are in non-REM sleep, which is relatively not as active, but there is still a lot of activity going on with the different neurons. So to call sleep as a state of being inactive is not right, because it is an active state of being. So that's one of the misconceptions. The other thing is that so we talked about the deep sleep. That's one of the major misconceptions. So we have two stages of sleep, two types of sleep, REM and non-REM, but non-REM has different stages within it. So when we are about to sleep or almost falling asleep, we go into what we call as non-REM 1 or N1 sleep, which is kind of going in and out of sleep. Afterwards, when we go into stage N2 sleep, which is more consolidated sleep, there are different activities, brain activities, which is shown on EEG. And I could show you some examples just for the sake of having some fun and looking at how the brain activity changes during different stages of sleep. We start having what we call as some K complexes and sleep spindles. And that is the hallmark of stage N2. But if somebody's in stage N2, it means that they are definitely sleeping. And N1 is kind of in and out of sleep or light sleep. N2 is definite sleep. However, after that, a person goes into stage N3, which is considered as deep sleep or delta sleep. We call it as delta because the brain waves are throwing delta waves, slow wave sleep. And that is the sleep which is most likely considered as a restorative sleep, which means that you feel more refreshed if you get more of that sleep. And the way it works is the more a person is sleep deprived, the more they are going to have N3 sleep in the beginning of the night. And as the night goes on, the person goes through different stages of sleep. So they go into N1, N2, N3, and then they go into REM sleep. So first REM period occurs within usually first 90 minutes of the 90 to 100 minutes of this of one sleep. So that is called a sleep cycle, meaning a person from being awake to going to N1, N2, N3, and then a REM cycle. And then after being in REM for a few minutes, a person goes back into stage N2 in most cases. So this is called a sleep cycle. And as humans, we go through about 4 or 5 of these sleep cycles throughout the night. But the difference is that as the night progresses, we tend to have less of delta or N2 or deep sleep, because when we go through N2 sleep, it is refreshing. And then as the time goes on, we tend to have more REM sleep towards the end of the night. So all these cycles are going on, but at the end of the night, before we wake up, we have a lot more REM sleep than N3 sleep. Usually we do not have a lot of N3 or deep sleep at that time. That's why when you wake up in the morning, usually you remember some dreams. Is that right? How many of you remember dreams? What is that?
You're right. That happens. How much N3 sleep do we get if we do get 7 8 hours?
You know, I'm sorry, I didn't understand the question because there's some mumbling of the record. Voice is not clear through the system.
Sorry, maybe I'm using the internet. It does happen that we remember the dreams at times.
Okay.
But how much N3 sleep do we get?
You know, so that's a very good question, because in general, we need about like 15 to 20% of the whole night sleep ideally should be in REM sleep. So Brother Najeeb, we can go to the next slides, go to number 4, number 5. Okay, so as you can see, we talked about these, you know, that a person goes through stage N1, N2, N3, and so these, like you see those REM periods where it says dream. So these are the REM periods throughout the night, and as the night goes on, we tend to have more of the REM sleep, and that's why when we wake up in the morning, we remember a dream, because we are most likely waking up from a REM period. Okay, so and there are different frequency of brain waves which corresponds to different stages of sleep. So let's move on to the next sleep. But to answer Brother Shahzad's question is, we need about 15 to 20% of a total sleep ideally should be in non-REM 3, which is N3, which is deep sleep. So let's go to the next slide. So this is like, you can see this. You can see the distribution. The question, like this is normal architecture of sleep. You can see that most of the time, normal adults spend about 50% of the time in stage N2, 5% in N1, about stage N3 is about 15 to 20%, stage REM is about 20 to 25%. So this is the distribution of our sleep. Let's go to the next slide. And this is what we were talking about. As you can see, a person falls asleep, they go into stage N1, they go to N2 and N3, and then they go into that black period, which is REM period. So you look at the whole thing, this is one sleep cycle. And as the night goes on, you see that the sleep cycle, there are more and more of REM sleep, and you don't get much of the N3 sleep later part of the night. Let's go to the next slide. And again, this is for academic purposes or just for interest. Like if you look at it, this is how the brain waves look like. If you look at it on EEG, when somebody is awake, they have mixed frequency. And you can see on stage N2, there's some spindles, which are rapid kind of burst of activity, especially in the central channels, and K complexes. But look at delta sleep, you see the brain is throwing out these deep waves. But when you go into REM sleep, the brain activity is almost like as if you're awake. But the difference is that the body muscles are totally paralyzed during that state of being. When we are in REM sleep, our body muscles, with the exception of eye muscles and pineal muscles and diaphragm, the rest of the body is actually paralyzed. So REM, otherwise the brain is very active, looks like you are awake. So let's go to next slide. And this is the same thing showing how different sleep stages correspond to EEG. I'm going to go down and look at a few more stages just to show you. Again, this is obviously somebody who's a neurologist would know more. The brain is more active. The wake sleep, you see a lot of fast activity. Next slide. You go to stage N1, you start seeing some slowing and some eye rolling movements. Some go to stage N2. You see all these marked, the K complex are the large green ones, and the sleep spindles are the one in purple. When you go to stage N3, you see the brain waves are more delta frequency, slow frequency. And then when you go to stage REM, the brain activity is quite like somebody is awake. But if you look at the eye movements in the top, they're very rapid, conjugate rapid eye movements. As you can see on the top where you see the green circles, you see the rapid eye movements, which means that the eyes are moving rapidly, but the muscle is totally flat, which means muscles are paralyzed. So moving on, let's talk about, let's learn about sleep debt, because that's a concept, what happens when people are sleep deprived. So there's a whole concept of what we call a sleep debt, which means that if a person who biologically and needs 7 or 8 hours of sleep, and they're not getting that amount of sleep, what's happening is that they're accumulating sleep debt. Let's go to the next slide. And then this sleep debt is something which keeps on accumulating. And then people carry their sleep debt. What does that mean? That means that when we are sleep deprived, we keep on carrying. The sleep debt tends to get bigger and bigger. Sometimes we try to pay that sleep debt by sleeping a little bit longer on the weekends. But sometimes it doesn't work. It doesn't work that you need 8 hours of sleep and you're just getting 6 hours of sleep, and on the weekend you'll get 12 hours and you'll catch up. It doesn't work like that. And then what happens is people keep on accumulating sleep debt. They may not necessarily feel tired, but it shows up in other domains, in their executive functions or their cognitive abilities, because the sleepiness, as you're sleep deprived, the sleepiness tends to get worse, but after sometimes it plateaus because the brain is able to kind of manage it. But then the other functions which they do not plateau. For example, like your ability to focus, concentrate, manage stress, your ability to have good executive function. So moving on, we know that we are all living in a culture of sleep bulimia, drinking a lot of coffee, and people are doing 2 or 3 jobs. But let's share a quote from one of the scientists, one of psychologists, but a sleep researchers from Harvard. And his quote is, "Sleep cures sleepiness." So if somebody, when I see patients who have sleep disorders, one of the main things I want to know is whether they are sleep deprived or not. Because if they are sleep deprived, we got to help them get enough sleep, and especially the teenagers, especially the college students, because nowadays with all the electronics, media, social media, being on Facebook, YouTube, people are getting a lot of extra light, which they, as humans, we were not supposed to at nighttime. And then it upsets their sleep rhythm, and they're up way at light. They become what we call as night owls. Another quote, which is about functions of sleep, this is by Dr. Rashoffan from Chicago. He's passed away, one of the pioneers in sleep research. It says, if sleep does not serve as an absolutely vital function, then it's the biggest mistake the evolutionary process has ever made. Think about it, going to the next slide. Because sleep puts animals at risk. I mean, they're sleeping, they can be prey to any predators or animals, and so sleep must have had some major function. Otherwise, God would have said, "What's the point of sleep?" And in Islam, there's a lot of verses in Quran about sleep as well. Now, I want to just have you look at this, the next slide, which is from an experiment done many years ago. This and we don't do those kinds of experiments done in Chicago, where if you can look at this slide and let me orient you this, that there are 2 mice. Both of them are on some discs. This is a disc with circle which rotates, and one of the mice, and both of them are attached to a polygraph with their electrodes on their head, which records their sleep activity. And what they did was it was an experiment, several experiments to do what sleep deprivation does to these animals. Most of these were mice or rats. And then what they did was, they would, if an animal was awake, they would not do anything. But then if the animal would fall asleep, especially the one which they want to be sleep deprived, they will run the disc. So the animal would have to walk. And obviously, while they have to walk, they could not sleep, because if they didn't walk, they would fall into the water. As a result, that animal was totally sleep deprived versus the other one, which would be able to sleep. Now, we're talking about this is not in humans, but this is in rats or mice. So can you guess what happened to one of the rats, which was totally sleep deprived? Can anybody guess?
They died?
Ultimately, they died, yes. But do you know what happened to them before they died? Because they had a lot of 10 to 30 days, they started dying. But before that, they started eating a lot. Their metabolism changed. They started losing a lot of weight. They started their fur. They started losing their fur, extreme weight loss, increased energy expenditure, and ultimately they died. However, if before they died, they were allowed to sleep they were able to regain all their health back. Now, there have been a lot of studies done and experiments done. If you do YouTube, you can look at sleep deprivation experiments. One of the famous jockeys in New York back in the 50s did sleep deprivation experiments, and some of the scientists were involved, and they had him stay awake for, I don't remember exactly, like 11 or 12 days, and try to see what happens during that time. Now, this gentleman who was then sleep deprived, that person was monitored very closely by the psychiatrist at that time to see what behavioral changes that person would have. Now, and that person, so they observed him so closely, so much so that they would have him, somebody would watch him even though when he would go to the bathroom. But he would try to trick people to have them look at another direction so he could just catch maybe a second of sleep or a few seconds of sleep. But they were so strict to a point where they would not let him sleep because it was an experiment. But then at the end of the experiment, what happened was that this person who was sleep deprived started hallucinating. And then it was thought that because the brain was so sleep deprived that the sleep started intrusions into the wakefulness without, even though he was kept awake or kept alert. And that's what happens when people are sleep deprived. And from experiments we've seen that people get sleep attacks where you're wide awake and your eyes are open, but your brain will go into sleep. So your brain will show activity of sleep. So the hallucinations were most likely coming from the REM intrusion, because he was so sleep deprived that the brain ended up going into sleep automatically. But he became paranoid, he was hearing voices, he was seeing things. But then once he was able to go to sleep, he slept for 20 hours, and then after that he slept for 12 hours, and then his sleep became normalized. So sleep deprivation does not kill humans. It's one of the worst painful thing people can do to prisoners of war when they have to ask questions. It's the worst thing. It's very difficult for people to resist sleep deprivation. So going forward, looking at the functions of sleep, and we are not going to go much into deep into that because and then for the interest of time, because we want to have questions. But what I want to talk about is, we want to learn about is that there are theories about non-REM sleep, but most of them are concerned about neurocortical maintenance, meaning that non-REM sleep is considered as something which is restorative, more restorative. For example, what happens is, then if you go to a couple of other slides, in the next few slides, I mean, we can go to the next one. The next one. Okay, so, and the next one, let's look at the next one. Okay, so this, we're talking about, no, the one before that. Next one. Yes. So if you look at here, functions of non-REM sleep, this is done mostly from Wisconsin. One of the psychiatrists over there has done a lot of research on non-REM sleep. He's an Italian guy, and he's shown that when we are sleep deprived or we are awake, what happens is there is no more synaptic potentiation, and there's the brain, actually the weight of the brain goes up. And then when a person is sleeping, there is synaptic downscaling especially with the slow wave, almost like you are cooling off a computer which has been warmed up. So when you've been, that the fan which we have on the computers, so when we go to deep sleep, it is kind of reducing the sort of loosening up the connections, the potentiation, the weight of the brain kind of gets back to normal. Now, going on to the next slide, we do not know much about REM sleep. We know that we dream in a REM sleep. There are psychodynamic reasoning of dreams, and dreams have functions in terms of psychological well-being. In our religion, we know that we do istikhara. Dreams connect us with the subconscious mind. However, we don't know the functions of REM sleep, with the exception that there is some evidence suggesting that it has something to do with memory consolidation. Or in another way, REM sleep also helps us delete certain parts of our memory which we don't need, so that we don't have to store those memories. So this is sort of the slides which I have, but let's move on to the questions. And I've got a list of questions. So let's go over the questions one by one. So we covered what deep sleep is. We covered hours of sleep. We covered what REM sleep is. REM is not necessarily deep. What about is some people, let's see, talking about when we don't get enough sleep, as we talked about, we develop sleep debt. But then also what happens is that steroids are not stress hormone levels go up. If we are sleep deprived on a consistent basis, our bodies, our heart rates change. Overall, it adds more stress within the system. But from cognitive point of view, the sleepiness may be the same. You may not get more sleepy, but if a person is sleep deprived more and more, the sleep debt starts getting worse and worse in terms of cognitive abilities, in terms of making decisions, thinking, memory, those kinds of things. Now, let's talk about CBTI, unless anybody else has any other questions about misconceptions about sleep.
So Imran, perhaps at some point, we've mentioned, the duration of sleep and the types of sleep and all of that. If you could comment at some point regarding the time of the day and sleep, is there any correlation of sleeping in the day versus the night, or changing your sleep cycle in that sense?
Yes, so that's a good question, because as we in healthcare profession, sometimes we have to do night shifts. Obviously, things have changed with the advent of bulbs and all that, because different cultures used to have different types of sleep patterns. For example, before, different cultures would people would sleep from 6, say for example, from the time of dark till 12 midnight. They would wake up around that time. They would socialize with their neighbors, and then they would spend 2-3 hours and during that time, and then go to sleep and wake up. So those were like more sleep in 2 different phases. Now we are all now used to getting sleep in 1 phase, which is okay, but it may not be necessarily very natural. However, sleep during the daytime. So all of us have what we call as a circadian rhythm. We have a clock in our brain, which is called a suprachiasmatic nucleus in hypothalamus. And that's the clock which regulates all our body rhythms, including sleep. And sleep is one of the rhythms. So there's so many other rhythms, for example, secretion of certain hormones, body core temperature. These are all body rhythms which are regulated by that suprachiasmatic nucleus. And in terms of the sleep, most commonly thought of normal rhythm is when we go to bed at night and wake up 7-8 hours. Now, some people don't like that. They want to have naps. Naps are fine. However, and again, these are common in different cultures, but nowadays it's becoming less and less. But naps should not be more than maybe an hour or so, because it can affect sleep. Not that as long as it doesn't affect sleep, it's okay. But because if people take 2 or 3 hours of naps in the afternoon or during the daytime, it has certainly an effect on sleep at night in most cases. Because when we're looking at what makes you go to sleep, we think about it 2 different processes. We call them 2 processes. One of them is called process S, or a homeostatic process. The other one is called process C, which is circadian pressure. Now, homeostatic pressure means that the longer you're going to be awake, the more higher your sleep drive is going to be. So somebody's awake for 24 hours, they're going to be more sleepy. So their homeostatic drive is higher. However, the circadian drive, there are few points during the whole 24 hours where there's a dip in alertness. And one of them is around 11-12 p.m., midnight. Around that time, we get more sleepy. But then there is another dip around 2 or 3 p.m. This is the time when most people used to take siestas, because it is independent of your sleep deprivation state, meaning even if you're getting enough sleep, still around that time, most people would experience a dip in their alertness so that they can fall asleep easily around 2 to 3 p.m. in the afternoon. Some people feel that it's after you take your lunch. Again, they may have some role of lunch, but your circadian rhythm is such that there is a decrease in your alertness, and it's easy to fall asleep around that time. Some people, as I mentioned, they think that food has something to do because your food is in your gut, so the blood goes into the gut. I'm not sure about that, but there's definitely a circadian dip. So in general, it's good to sleep at night, and naps are not necessarily dangerous or bad, but it should be monitored to a point that it does not kill your sleep drive, the homeostatic, the S process S, which I'm talking about. Does it make sense? Or
Yes, yes, absolutely. Thank you so much. That was very useful.
Okay, okay. Any other questions?
Sorry, Imran.
Yep,
You
yep.
mentioned about getting a good sleep. The question I have is that if we get 6 hours or less sleep, our inhibition goes down, right? You mentioned, and the reasoning we give in to arguments or when it comes to cognitive functions, that goes down. Can you talk about it a little bit?
Yes. So when we are sleep deprived, we are getting, say, you need 8 hours of sleep and you're getting 6 on a consistent basis. First thing is going to be initially you're going to be sleepy, but after some time your brain is going to become used to it. So you're not going to feel sleepy, but then your different cognitive functions, including your ability to focus and sustain attention, would go down. Your ability to manage stress is going to go down. Your ability to make executive decisions or think critically is going to go down. Person may become more irritable. They may get more snappy. Their threshold for losing temper or manage, that goes down as well. So again, I mean, so when we talk about cognitive abilities, I'm not talking about specific domains, but some executive functions, irritability, focus, concentration, memory, short-term memory. Like if I tell you, okay, Shahzad, you have to do this, go to this room, go and bring this back, and then come and put it over there. Short-term memory that may be affected by sleep deprivation. Does it make sense?
So can I add a comment there? I mean, this segues right into the concept of general stress. And, you may have certain, inhibitions that you get, like you said, snappy or irritable. Mm-hmm. But, again, the rest of the systems of the body are also affected. In fact, your immune system is affected. Your cardiovascular system is affected.
Absolutely.
And ultimately, disruptions in sleep pattern, I think, also lead to more pathological disease. You may even develop, heart disease, etc. early on. I think that is the general concept.
Yes. So obviously, sleep. So we know that disorders like sleep apnea or even insomnia, there is people who are not getting enough sleep or sleep deprived. It is going to have some effect on their overall body, their immune system, and their cardiovascular health, their emotional health. Now, we know that people, for example, I can give you a very good example, especially among teenagers, because I see a lot of teenagers in my practice. Plus, I've written a couple of books on sleep disorders with some of the authors like Con Iber, who's an expert in sleep disorders in teenagers. Now, think about teenagers. So we talked about the circadian rhythm. When teenagers are in that age, 15, 16, 17, around that, their brains automatically become night owls. So the circadian clock which they have becomes more delayed. So they become night owls. And then being on the phones, being on television, YouTube, all that does not help, because the light suppresses the melatonin in the brain. As a result, they tend to go to bed way late. But what happens? They can go to bed late, but when they're going to school, what's going to happen? They can't fall asleep at 10, 11 p.m. They're going to fall asleep at 1, 2 a.m., but they got to go to sleep. So parents are going to wake them up at 6, 7 a.m. Now, what happens to those teenagers? They are chronically sleep deprived. They're chronically sleep deprived, like getting 5, 6 hours of sleep. They have a lot of activities, sports, band, things like that. So they're getting 5, 6 hours of sleep. Their brain needs 9 hours of sleep in that age group. And then in the morning when they're in the class, I mean, they're sleepy. Even if they're not sleepy, they're going to have trouble focusing. They're going to have trouble managing stress. They're not going to be able to understand the concepts that clear. And the overall stress adds up. So one of the, and then they tend to develop more depression, more anxiety disorders. They tend to be diagnosed with ADHD as well, because their brain is only getting 4 or 5 hours of sleep. But now their whole system is under stress, and then they can't focus in the class, they're falling behind, that adds more stress. So it becomes a vicious circle where they can't get out of it. And then and when you're sleep deprived, what happens? So let me ask you this, we are all like people who are professionals. If you're sleep deprived, is it easy for you to take care of things, notes and everything else, versus like when you're full, like post call, if somebody's post call, can you do the dictation the same speed? Can you take care of the notes, the patient the same speed or not?
So I guess it's a rhetorical question. The answer, of course, is you can.
No, but you know, so your speed of processing goes down. So if you didn't
Correct,
get
yes.
yeah, so this happens to, if the chronic sleep deprivation has a similar effect, but it's more subtle. You don't see that. So if you're full night sleep deprived because you're on call, and the next night you have to write a note, it's going to be slow. You'll take 20 minutes versus 10 minutes you'd do it otherwise. But when you're chronically sleep deprived, the effects are similar, but they're not like as dramatic. You don't see them because they're more subtle, but you're still going through those effects, especially in teenagers, because they don't tolerate sleep deprivation very well.
Right. No.
I just want to add one thing.
Uh-huh.
I'd like to add one thing. In geriatrics, there's a lot of studies done on memory and sleep. So I'd like to add a couple of things, if that's okay with you.
Absolutely.
So basically, they looked, a lot of peer review article has been published and all those things, and they found out that the optimum amount of sleep now is 7 to 8 hours, and they did the studies on that. And this is like, not, we are talking about child and teenagers, but we are talking about adults and a little bit older people. They expect 7 to 8 hours. So when they did the study and they looked at the people who were sleeping less than 6 hours, they found that as compared to people who are sleeping 7 to 8 hours, good night sleep or adequate amount of sleep, the amount of memory loss was at the most 40%. And that was a significant amount of memory loss were happening, like new memory was not forming, or they were taking longer time to get it done. And they look into the numerous issues on that. So these people were given a good amount of sleep, then they were asked to learn new things, and they go back to sleep again. And then they were asked to, do you remember all those things? And the people who didn't got the good amount of sleep before and after, they were at the most 40% behind than the people who were sleeping adequate amount. And then when they look into minor details about that, they found that the sleep before learning really cleans up the hippocampal area to absorb the information. The brain has to be cleared up. And then during the delta wave sleep, this is where the memory is being transferred from the hippocampal to a higher area. So they need to have sleep before and sleep after learning, and that's really helped them to consolidate the memory into the higher area of the brain, as compared to people who don't sleep before and after. So that was a significant finding. It came in the Science and other peer review article that 7 to 8 hours are really required, because in dementia we see the memory issues, and we look into, and also other psychiatric disorder like ADHD. You look at the depression, anxiety, and so many psychotic disorders and all those. So sleep is a very significant entity which we need to consider, and they also look at the continuation of it. So so if somebody is not means you cannot do like weekend you catch up with sleep and the rest of the days you sleep less. It does get affected. So it has to be a continuous manner. And that was a significant finding regarding the memory and the sleep was. So hopefully it helps other people to understand.
Absolutely. No, I mean, also one of the things which I didn't mention is that recently in the last 5-6 years, there've been very landmark findings about sleep. So when we think about the brain, like the functions of sleep, most recent, like in the last 5 years, where that there's been a discovery that in the brain there's what we call as a glymphatic system. Just like the lymphatic system, the brain has its own glymphatic system, which means that this is something which get rid of the waste at night. So when you sleep, what happens in these lymphatic systems, and they think of them as vessels, like lymph vessels, they expand during the night time to get rid of all the waste from the brain, so that it can be thrown out of the brain. So that is also one of the functions that only happens when a person is sleeping. So this was a very landmark discovery in the last 5 years.
Let me add on that too. So what really happened between the two neurons is the neurotransmitter release. So during that release, there's a amyloid beta is released also. That is cleared up by the lymphatic system. So there's a critical point where if you don't sleep, that is not being cleared up, and this keeps on accumulating for a long period of time. So when it keeps on accumulating, you get beta amyloid deposit in the dementia complex. That's the initial process of developing Alzheimer dementia. Then later on, when the neurons try to refix it, the tau proteins inside the neuron start to work on it to clear up those things. And what they do is microtubular formation inside the neuron get twisted. That's a tau protein process. That's a secondary process. So this all sleep really helps to clean up your beta amyloid, which is the initial process, later on develop into tau proteins, and then you have a whole accumulation. This is all related to sleep. And that has been really found out in the last 15 years, that how the glial cells really helps us to clean up the whole system. And if you do good amount of sleep, that will help slow down the process of beta amyloid, which is one of the major precursors of Alzheimer dementias. So that's what I want to add to it.
Imran, if you can talk about, power sleep, power nap. In Islam, we say Kailula, which Rasul Akram Sallallahu Alaihi Wasallam used to do in the afternoon, which is don't go into, and which is only like half hour. You don't go even into REM sleep. Can you talk about it?
Yes, so that's a good question. Thing is, I mean, if you talk to sleep experts who are really experts on sleep deprivation, the best way to take a nap is that you take it less than half an hour. Because the reason for that is because when you take a nap and as I explained to you, the different stages of sleep. Remember, stage N3 is restorative sleep, but then when you get into stage N3 sleep, no, stage N1 and 2 is also restorative. It doesn't mean that they are not restorative. But when you go into stage N3 sleep, it becomes more like difficult to get out of it, meaning that you have more sleep inertia during that sleep. So if you take a nap for like an hour or so, then if you get into stage N3 sleep and you wake up, you're going to maybe feel not as refreshed during that time because you may be coming out of stage N3 sleep. So the best way to do it is you go to sleep for 30 minutes with an alarm, because you are not going to go into deep sleep, which will cause you to go and have sleep inertia. So when you wake up, you get the most refreshing component from just like a 25-30 minute sleep versus taking an hour where you may not get enough. You may still go into deep sleep, but then if you wake up from deep sleep, you're going to have a lot more sleep inertia and you may feel more sleepy. So that's the whole concept.
And what happens to the body? Brain doesn't shuts off, right? So what does it do to the body to our functioning?
No, obviously it is helpful. It is helpful. So if you get 30 minutes of sleep and you're somewhat sleep deprived, that will help, kind of reverse whatever wrongdoing sleep deprivation has done to your body. So that refreshes you. You get, and as brother was about some of the stages, like for example, if you're trying to remember something and you sleep and you wake up, there's more consolidation. So memory and those short-term memories, functional memories, those aspects of your cognitive functions get better.
Thank you. Thanks.
Dr. Imran, can you tell us about cognitive behavior therapy? There are two components, like the behavior and the cognitive portion, as compared to the people who are taking medication, because it has been seen that CBTI is as good as medication. And
so
in
here's
CBTI,
yeah. No, I think that's absolutely one of the best treatments, because I was on a consultant for the meta-analysis which was done in 2016 for insomnia treatments back by the American College of Physicians. And their recommendation was CBTI is the primary treatment for insomnia, not the medications. So CBTI is the primary, and there was another meta-analysis done by the American Academy of Sleep Medicine, and they came up with guidelines in the same year, and they came up with the same conclusion. CBTI. Now, what is CBTI? CBTI is slightly different than CBT for depression. It's cognitive behavioral therapy for insomnia. And there are two main components, obviously, as Dr. Najeeb mentioned, cognitive and behavioral. And the difference, obviously, it's done together, usually in several sessions. But the behavioral components, basically, you can explain them that people who have insomnia, in a way, they have learned to have insomnia, more like the conditioned response which a person gets. If we remember from the Pavlov dog's experiment, if you remember all that experiment, you know that there's the concept of conditioned response. So people who have insomnia, they've had problems with stress and they can't sleep in the bed, and they're in their bed. So they're conditioning, they're in a way programming their mind that when they go into their bed, the brain automatically gets more hyperactive and they get more stressed and anxious about sleep, and they can't fall asleep in that environment because the bedroom environment subconsciously reminds them or associates they associate that with not being able to fall asleep. So they go into their bedroom, they can't sleep. So the behavioral component which we use is called stimulus control, which basically means that we have to disassociate that conditioning. And the way we suggest doing it is, obviously, we teach them learning progressive relaxations, managing their stress, but we suggest that they do not spend time in their bed. They spend time in their bed only when they're sleeping. But if they can't sleep, they get up, go to the next room, do some quiet activities like reading something boring, not being on YouTube channel or watching movies, not being exposed to a lot of light. And when they get drowsy, they should not sleep in the living room. They should go back into their bedroom. So now they are associating bedroom with being sleep versus with stress and not being able to sleep. So that's the behavioral component. The cognitive component is more when we are helping them with their automatic thoughts, with their belief system about sleep. For example, most people who have insomnia, difficulty with sleep, their beliefs about sleep are somewhat skewed, or they're not necessarily 100% accurate. Like they start believing strongly that if I don't sleep, I'm going to die, I'm going to have problems, I'm going to get sick. Well, it's true that can have that, but we have to kind of tone that down. We have to make sure that their fear, their beliefs about sleep deprivation are more balanced. So that's the cognitive part of the CBTI.
Yeah, it's very important because this is one therapy when you learn it's lifelong,
Exactly.
and there's no side effect.
Yeah.
But unfortunately, most of the people understand that take medication for sleep with all the side effect, and we struggle with that. But then CBTI is one other avenue which has proven that it can be lifelong without taking medication. You change your behavior and it helps your sleep. Unfortunately, a lot of people don't get this point across, and as long as we educate them, that will be very helpful.
Yes, absolutely.
Imran and Najeeb, is there a possibility that you guys can do a CBTI session where you can teach all of us how to change our behavior or thinking towards sleep?
Yeah, we can certainly do it like a discussion and have some sort of some sort of a program, like maybe different slides and some sort of material resources. Najeeb and I can work on that.
Yeah, so it's
That we can
actually
practice.
a whole training. It's a 4 to 6 week training where and it's varies from person to person because the behavior and cognition of everybody is different. So you have to work with each of them to tell them. So basically, the guidance is like in journal is you tell them that's what it is, but individually you have to approach it and get tuned to your needs, and that's very
Okay.
important.
Okay.
I'm just
Okay.
giving you a layout how it works because it
No,
does not
no.
work for one person to another. like psychotherapy. Just you can tell them, and then when you go individually, you figure out what is the one that bothering you, because it does not. Everybody has a different issues that bothers them subconsciously. In your cognitive behavior therapy, you go into subconscious mind to figure out what is bothering you deep inside, and you're presenting this way. But it's very good idea to learn about it, so then you can approach it that way.
Yeah.
Because, yeah, I think he's right. We can't do the training in one session. We can give information, and there are apps which I can share. There are apps which some of them are free, and people can use that. And sometimes they can help. Obviously, it's not as effective as if you were to go to all these 8 to 15 sessions with somebody who's trained to do CBTI, but they can certainly help kind of modulate and manage your sleep.
So, like Imran, with your credentials or Najeeb's credentials, is something that we should consult, right? Individually.
Yeah. Yeah.
Yes.
Okay.
But what I like the idea that we learn more about it, because I'm sure there are parts that we can apply even if we don't really have insomnia.
But
Yeah.
So at
the
least
other
from
thing
a preventive standpoint, right?
yeah, but it has to be active process, learning by doing it, and that needs a lot of timing. A lot of when we see patients, all those things, people like to hear about it, but they don't want to apply on it, and there where the whole struggle with the psychiatrist comes, that we are not moving one step up. We are just revolving on one step. So it's good to know about it and be aware of it, and then you have to move up. The patient has to move up, and not just patient learn everything and blame the psychiatrist. You're not helping me. That is the biggest issue.
No, that's a very good point. Imran, the experiment that you showed about the two mice. We know that human and mice DNA are the closest compared to any other creatures. But in terms of humans, how for that experiment, how close humans come to that condition where the rat died after deprived for a month?
So humans don't die. There's no experiments. Obviously, there are no experiments which are done like that. But we know from the crimes and war situations and things like that, humans don't necessarily die. At least, there've been maybe a case report or so where somebody died, but in general, their system gets totally out of whack. For example, they become psychotic. They can become psychotic, paranoid. But the issue is that when humans are not sleep deprived, even though you keep on slapping them, and their brain is strong enough, big enough that it will start going into some sleep here and there. So micro sleep, we call it as micro sleep. Even if you keep them awake, the brain is going to start going into micro sleeps.
I have read one article on that. That is actually a person got a stroke in the brainstem, which is actually controls the sleep modulation. So this guy could not go to sleep because basically as soon as he goes to sleep, the sleep modulation, which is autonomic, stops and he wakes up. So he used to could not go into a good sleeping cycle because he stopped breathing, and they have this was a long time ago, so when there was no ventilators and things like that. So the person died after 2 months because he could not go to sleep. And that was documented. That's how they found, but it's based on the stroke in the brainstem. Now things have evolved, that we have ventilators and all those things, so that helps the breathing cycle. But unfortunately at that time, this was not a study, this was just a case report, with an interesting case report that a person died because he could not sleep.
Yeah. And Imran, you mentioned about what happens to the kids, but for adults, not only it affects our professional life, but also the family life too. Can you talk about?
Obviously, think about it. Like if as adults we are sleep deprived, it has, and you're not as patient. Your patience runs out quicker. You're not as kind. Your irritability goes up. So that says a lot. It can seep into your relationships with your spouse, with your family members, but also at work. So that's why, I mean, there's such a significant, that's why, different cultures, religions, they pay so much attention and suggest that we sleep properly. Sleep, there's a and even in our religion, that sleep is considered as important. Even religions like Buddhism and other people, I mean, they put a lot of attention to sleep. So there's definitely, I mean, if a person is sleep deprived, they're going to get more irritable. It's going to affect their relationships. I mean, and with themselves, relationship with themselves is so important too, because they're going to feel irritable. They're not going to feel good. So it has a, it has a domino effect on the whole relationship world.
Another thing
Thank
I'd like
you.
to add is that sleep hygiene is a portion of the CBTI. Before they used to think sleep hygiene is everything, but no, CBTI is a whole component. Sleep hygiene is just part of it.
That is true.
Thank you. Very informative, Imran. And
Thank you, Najeeb, and
Thank you very much. It was
good
very
discussion.
nice.
Yeah. Okay. Any other questions before we stop, my friends?
No, I just wanted to jump in and also say thank you. That was a very, very interesting discussion. I'm sorry I had to jump out during the last 10 minutes. So I'm afraid I must have missed out a lot of that CBTI discussion. But inshallah, I'll touch base with Najeeb.
Sure.
And get some more
Yeah, and
information.
this is recorded, so
Yes, of
you
course,
can review
yes,
it.
that is true. All right.
There's somebody who's asking
Yes,
question.
we have a question, Asif.
Yeah, thank you very much, Mr. for doing this wonderful thing. Just a quick question. How does food affect the sleep? Like how much, how early, how late does it affect the sleep pattern?
So, and again, Brother Najeeb can answer that question as well. I think in general, the recommendations are that we don't eat food before we go to sleep. Just before going to sleep, there are certain types of food which are more rich in serotonin, for example, can help with sleep. For example, yogurt, milk, bananas, those have some. So people who, if you take that, sometimes they can be more sedating. Turkey, for example, can cause people to have a bit more sleepiness. But in general, the recommendations are you don't want to eat a very heavy meal before you're going to bed. I mean, should not eat much, but a person could have a small snack before going to bed, because sometimes what happens is, if especially in the US and in the Western world, if people have their supper or their dinner at 6 p.m. and they go to bed at 11, it's been quite some time. And then sometimes people wake up in the middle of the night with some hunger pangs, and they don't even know what's waking them up. So it's always, you could take a small snack before going to bed, like 20 to 30 minutes before going to bed, but not heavy meal. Najeeb, what do you think?
I totally agree with you. So once you take food, how much amount of carbohydrates and proteins are all there, and fat. So if you take a lot of carbohydrate, you have insulin surge goes up, and depends on your medical issues too. So you have all the hormones are secreted and they are very active then. So you go into a different drive, and you don't want to activate the whole system and have high level and low level. You need to settle down. So it's better not to have a significant amount of carbohydrates and things like that, rather than to have lesser amount, because you have to digest that food too, and that body needs to work on that issue. So you have different hormones producing in that, and that influence the cortisol and all those levels. So that activate more sleep. So you destroy the rhythm. So you should not destroy the rhythm. So it's better to not to eat too much before going to sleep, because you produce acids and all those things. So I do agree with that we need to watch what we eat before going to sleep. Hopefully I answer your question.
No, yes, you did. Thank you so much.
Great.
Anybody has questions? The ladies, we haven't heard from you, so if any of the ladies have any questions. Okay, Brother Imran, I have a question myself. Because you mentioned like certain cultures had like a sleep and then they wake up and socialize and then they sleep. We know in Islam we have Qiyam al-Layl, right, or Tahajjud.
Mhm.
So can you explain to us if that fits in any, or science is proving something or not? Like we find and waking up early as well, because the Prophet ﷺ encouraged us to wake up early, and we see our kids, especially when they are at break, they stay up all night and sleep all day, and you have all that messy cycle.
Yeah,
And
no, that's not healthy. Obviously, so what I think what you're talking about is let me help. So you're talking about the Tahajjud prayer, or
yes, yes.
so
So I'm talking about two things, right? One is the Tahajjud prayer, and what now we're doing with our kids, allowing them to stay up awake all night. They don't sleep at all, and then they sleep daytime, which really changes the cycle, right?
Okay.
But I'm talking like the first question is about the Tahajjud, sleeping early, waking up for Tahajjud, go back to sleep, wake up at the
I'm not
Fajr.
aware of any
So-
studies, but I personally, I mean, I think it's like if you go to bed early and you wake up to pray and then you go back to sleep and then wake up early for Fajr, I think there's absolutely, I mean, it's a good way to do it. It's the best way, as long as a person is, they don't have anything going on in their lives, or they're not stressed out or have insomnia that they can't go back to sleep. So there's absolutely nothing wrong. It is absolutely healthy to have tahajjud and going to bed early, and then waking up early for Fajr. That's the best way a person could sleep. Coming back to the other question, the teenagers, the kids, I want to mention that back a few years ago, there was a study, because as I mentioned that most of the teenagers, they have trouble with sleep because they can't fall asleep partly because to some extent their brain becomes a night owl, have more night owl tendency. But with the electronics and the media, that has really played havoc, and that's made things so difficult that teenagers can't go to sleep, and they get misdiagnosed with insomnia. They get given they're prescribed these and hypnotic medications which don't work properly. So there was a study I think in Colorado, where a lot of these kids, and I don't remember the name and I can't quote the study, where they were taken out for camping for a couple of weeks. These kids had problems with their depression, anxiety, sleep problems, could not sleep. So they were taken out for camping for 2 weeks with the support and everything else. And after the end of 2 weeks, they were sleeping absolutely normal because they were more in rhythm with the nature, with light. They were not exposed to bright light at night. They didn't have the gadgets and the cell phones. They would wake up with the sunrise or even before, so their sleep rhythm became natural, and they didn't need any medications. I mean, but in cases like those, if we can't do that, I mean, sometimes we can use a melatonin in a very small amount in teenagers. So with going to bed late, we're staying up late, that's absolutely unhealthy. That is, there are studies showing that predisposes teenagers, young adults to depression and anxiety and other problems as well.
I totally agree. And, melatonin is not a hypnotic, and a lot of people use it as a hypnotic, and that should be kept in mind. Melatonin just tells the brain that it's nighttime, so there is what we need to learn about it, that there are a lot of steps after when you take melatonin to go into sleep. So it's just not a hypnotic. That's keep in mind that too. It's very
Absolutely.
effective for teenagers because their sleep cycle is skewed towards later time. So you are inducing the brain that it is nighttime to go to sleep. So it helps them. So the time
Absolutely.
cycle or the clock cycle, you're shifting it. So it's not a hypnotic. Again, I will say that.
No, you're absolutely right. I totally agree with that.
That's why it does not work on adults much effectively than teenagers, because their sleep timing is different. So you fix the timing, and your optic, the sleep centers, you regulate them.
Yep, absolutely.
We have a question in the chat if Brother Imran, you want to take a look at it. So in short, I see technology is ruining our lives, even though it's helping us in a lot of ways, but it's ruining a lot of things like as a trade-off.
So the question is, I struggle with going to sleep very late and wake up in the middle of the night. Is there another way than medication like exercise and herbs can help with it? Obviously, it depends, you have to get clinical history, what's going on. There could be so many other things going on, but exercise certainly can help. But it should be done not before going to bed. It should be done earlier in the evening. And as I mentioned, that the cognitive behavioral therapy, and Najeeb also mentioned that we don't want to be in the bedroom when we are not sleeping. We got to rechange that. So the time when you're spending in bed and you're not sleeping and you're stressing out about sleep and trying to force yourself to sleep, that's actually counterproductive. That's making things worse for the future. So forcing oneself to go to sleep and can't sleep, it doesn't work like that. You cannot force yourself to fall asleep. You can force yourself to stay awake, but you cannot force yourself to fall asleep. Therefore, you want to be in a relaxed state so that your brain falls asleep automatically. So staying in bed when you can't sleep is the worst thing a person could do. People think that, okay, I'm in bed, I'm trying at least, I'm forcing, I'm just tossing. That's the worst thing you could do. So better to get up, go to the next room. If you don't sleep much, doesn't matter, because ultimately you're going to end up getting into that rhythm as long as you're not stressing yourself and laying in bed and tossing and turning.
Okay. Dr. Imran, we have another question. I just got it. How much of a break is needed from a blue screen before going to sleep? And also, how much of a break is needed for a food before sleep?
No. So what was the first part of the question?
The first was how much break is needed from the blue screen before going to sleep. That's mean from the computer.
I don't have a study to quote, but I think it should be at least like last hour or two. Maybe person should not be watching things on TV because that's stimulating, not just the light, but what you're watching. It has an impact on your subconscious and what kind of dreams you're going to have. So at least an hour you should not be on the TV or screen before going to bed.
And I think so. I heard about it that it's the blue light is really activates your brain. That's one of the anything similar to that frequency.
Blue light is like, obviously we're talking about the blue frequency light, which is present in the light which you see from the computer. But there are apps, there are goggles which you can wear, which are blue light blocking goggles. And there's some evidence that they may help. So if you have to be on the computer, especially for teenagers, you can buy those goggles or buy some apps which will tame down the blue frequency of the screen. And that could be helpful too.
The other one is how much time before food and going to sleep is. That was that.
I would say, again, I cannot quote, but general recommendation is at least a couple of hours. Any other questions before we stop, my friends? Hello?
Well, thank you, Imran. It's really, really informative.
Well, thank you for listening and attending.
Thank you all for joining in. I really appreciate
I don't think there's anybody who has any questions with this. Thank you all for being here. Brother Imran, we appreciate your time and effort with this, and the same Brother Najeeb and Shazad and everybody else. So we appreciate you all. I'm going to just make a dua. Subhanakallahumma wa bihamdika. نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين وصلى الله وسلم وبارك على سيدنا محمد وعلى آله وصحبه أجمعين. Assalamu alaikum all. Inshallah, we'll see you next week at the same time.
Thank you for all of us to join. I appreciate for coming. And thank you, Dr. Imran, for joining with us.
Thank you so much, my brother. Okay.
Assalamu alaikum.
See you. Thanks.
Allah Hafiz.